The Limpopo province is gearing up to roll out its vaccine program. The province is expected to receive over 44,000 doses of the 1 million doses already received from India. To speak on their plan, Health MEC Poppy Ramathuba joins me now. Thank you very much, MEC, for your time this afternoon. We know your department is very busy trying to implement all the necessary measures to get this rollout going. So just to confirm for us, how many health workers are eligible and included in the rollout of phase one?
Afternoon to all your viewers. What we can indicate is that we have an estimation of 50,000 healthcare workers. The 44,526 that we have received a promissory note from the minister that they will deliver those vaccines. Unfortunately, has not included the remaining 6,000 employees who are not necessarily directly employed by the Department of Health through PESAL system. But however, because of the nature of their work, for instance, our security guards who are employed by service providers and are working in the department, because what happened with the 44,526, it's the number extrapolated from PESAL system, the system that is used to pay our employees. Those are employees who are directly employed by the state, but we have got other employees, as I've indicated. The Red Cross has also indicated they've got employees who are assisting us, our community healthcare workers who are also employed by some NGOs. We also have got professional nurses who are also, for instance, ANOVA, working for the department. So that's why we are estimating at 50,000 healthcare workers employed by the Limpopo Department of Health.
And how will those additional roughly 6,000 people be allocated? How will they be made provision for?
What we have decided as a province to say, in the meantime, while we've written and make a request of extra 6,000, we are saying we have developed our own category that we will be utilizing towards vaccinating. We're saying while there is a guideline from national of phase 1 to be vaccinated, we are going to have phase 1A and phase 1B. Within the phase 1A, we're going to look at those healthcare workers who are mainly dealing with aerosol generating procedures. For instance, those who are intubating, ventilating patients, those who are working with your mouth and your nose, which is where this virus is being housed. So we look at your degree in terms of your risk. We then look at category B, which is those who are working directly in the COVID-19 wards, and also those who are working in the patients under investigation wards. We further on says we will go to category 3 within the very same 1B, where we will look at employees like your admin clerks in the OPD, opening files, and also your security guards. Whether they are employed by the state or not, as long as they are interacting with patients, they will be within category 3. Then for the category 5, it's our employees within the department who are included in the 54,000, but they are, for instance, your admin, your finance people, your human resources. Those are people who do not interact directly with patients. So they will be the last one. So in case the people who get shot would be those ones who are not actually directly dealing with the patients. If we do that, we will be able to cover everyone. So, but if we get the extra 6,000 that we have requested, we will be able to cover everybody. We further on said, in terms of the human resources that must deal with the whole vaccination, we got our teams. We are supposed to have 200 vaccinators. And at the moment, I can comfortably report that 169 are already there, already trained. These are professional nurses who will be doing the actual work of vaccinating. In each team, you will have a professional nurse who is supported by an enrolled nurse or enrolled nursing assistant, who will also be supported by a pharmacist, admin clerks, or data capturers, so that the vaccinator must not deal with logistical or clerical work. You've got that, and also security to look at the safety of the vaccine. Now, what they are going to do, we are giving them targets to say in a day we should be able to vaccinate between 50, we have also agreed to say if you look at their working hours that we have scheduled for them, they will be able to vaccinate at least even 100, up to 100 people. So if you get your total of 200 vaccinators who are vaccinating each 100 in a day, within 5 days, you would have vaccinated the number that you needed. That is why we are saying as a province, the 2 to 3 weeks that we have been given, we are comfortable that within the 2 weeks, we would have been vaccinated. Everybody who is supposed to be vaccinated during phase 1 would have been vaccinated due to that. So currently, we've already
Dr. Ramatuba, sorry, I'm going to jump in there because I have a question specifically about the second dose. We know that this planned rollout is of the first dose of that AstraZeneca vaccine. Do you have a timeline from National Department of Health of when you'll be receiving more doses to be able to administer the second dose?
Let's just remember the COVID-19 that we are receiving, which you have just mentioned. Its intervals range between 4 and 12 weeks. And the highly recommendation from even SAPRA speaks even of 8 to 12 weeks. So you would understand that given that time interval, we will be able to give the first dose, and probability are that we might receive even other vaccines before we get to the 12 weeks of the second dose of this. That is why our plan is also looking at the second phase of vaccinating. And the second phase, we have an estimation of a population of 1.66 million people. These are other frontline workers who are your police, and who are that number estimation, if I'm not mistaken, of police, traffic cops, teachers, it comes to around 250,000. And also we have got people who are above 60 with above 18 with comorbidities, there are 800,000. Above 60 people, we have found, those numbers come into a total of 1.66 million. And then finally, you will have the phase 3, which we have estimated at 2.25 million.
Dr. Ramatuba, just to come back to phase 1, where will the doses be administered to healthcare workers in phase 1 within the Limpopo province?
We have already indicated that we are going to deal with direct deliveries to our facilities. 39 facilities have been accredited already. They have got the storage capacity because COVID-19 its requirement is between 2 and 8 degrees Celsius. Most of our vaccines that we are currently storing, that we do have, we are using on average around 4 degrees Celsius. So we do have those storage cold chain requirements to be met. So what is going to happen is that when the 10 days that the minister has spoken about come to lapse and quality assurance has been done, the vaccine will be delivered straight from the laboratory to the hospital. If it's Petersburg, it will go straight to Petersburg Hospital. It will go straight to Mankweng. It goes straight to the hospitals themselves. We are not going to be involved or engaged in any transportation of the vaccine. It will be the whole process from national. It will go to the facilities, and that's where we're going to start to vaccinate. And we are saying to be safe, let's say on or before the 14th and the 15th of February will be the date wherein we believe that our first healthcare worker to be vaccinated will be vaccinated on that particular date. If the response team agree that that first candidate must be the premier, that will happen. If they recommend that it must be the MEC, we will make sure that is done. But come that time, we will be able to vaccinate all our people, and given the time frame, we would vaccinate everyone who would require to be vaccinated.
Thank you very much for taking the time to speak to us, providing that clarity on that, the details of the Limpopo province vaccine rollout plan. That was Limpopo Health MEC Poppy Ramatuba.